Involvement with the criminal justice system is life-changing. It matters.
Having a justice system that works is a really important part of a democratic society.
I'm Penelope Gibbs, Director of Transform Justice.
I'm Rob Allen. I've worked in and around criminal justice all my career.
This is the Transform Justice podcast, throwing light on the criminal justice system.
Hearing from people who know.
It's about whether the system's fair
and what can be done to make it better.
Today we'll be talking about drugs policy and the arguments for decriminalisation. Last December, the government launched a 10-year plan to tackle drug-related crime. But most experts are arguing for decriminalisation. Rob and I are joined by two champions of reform, Alex Stevens, Professor in Criminal Justice at the University of Kent, and Ian Birrell, journalist. Rob, I think for some people, when they hear drug decriminalisation, they imagine drugs being abused openly in public and flashy billboards advertising the latest high. Surely that's not what we're talking about here.
Very few people, I think, want a total free-for-all. It's really a question about what kind of regulation should work best for drugs. I've been doing some work in Portugal where 20 years ago they removed drugs from the scope of the criminal law. So possession of all kinds of drugs can be dealt with by an administrative law or a process. They can have drugs removed. There's a committee that people come in front of to try and dissuade them from using drugs. But at the end of the day, it's not a criminal matter. It's something else.
So, Alex, it can be quite confusing. People talk about decriminalisation as in Portugal. But how is that different from legalisation?
Normally we use decriminalisation to refer to policies which remove the criminal penalty for possession, but leave criminal penalties in place for production, importation and supply. Whereas legalisation removes criminal penalties for the sale and supply of these substances. There can also be depenalisation when the law stays in place but the police stop enforcing it, and systems for diversion where the law stays in place but the police divert people who are caught in possession from criminalisation to an educational or therapeutic response. And there are plenty of places that have done all of these things. In the UK, we've depenalised to some extent the possession of cannabis. There are several countries, maybe about 30 countries, that have used some form of decriminalisation, Germany and Mexico being two examples of those countries. And there are places like Uruguay, some states in the USA and Canada that have legalised the sale and supply of cannabis.
So the government have promised, a huge investment into drug treatment and tackling drug-related crime. But then the other day, they published a white paper where they're proposing a huge clampdown on recreational drug taking. Is this part of a coherent strategy?
So the overall aim of drug policy is to keep people safe. And the means that's been adopted for that is to try and reduce the levels of drug use. The drug strategy continues a long tradition of trying to achieve that aim by cutting supply, preventing use, and treating people who've got drug problems. What was added in December 2021 was a promise to get tough on recreational drug users. And the latest white paper from the government is the plan it's proposing for how to do that. The problem with all of this is that there's been several studies, including two of my own, which show that there's hardly any correlation at all between the levels of punishment that people are threatened with for use of cannabis, for example, and the rates of cannabis use in those countries or the levels of drug-related harms. So the white paper has a range of, I would say, fairly incoherent responses, proposals, with a stated aim of reducing levels of drug use, but I don't see much evidence that the measures they're proposing would actually do that.
Okay. Ian, the white paper is called Swift, Certain, Tough, New Consequences for Drug Possession. Why do you think the government is taking such a hard-line approach to recreational drug use?
Well, very obviously they see crime as an essential part of shoring up their right-wing flank and appealing to the new red wall voters It's sad, really, because even privately, when you talk to a lot of MPs, they admit that this is not working. Britain has the highest number of cocaine and high-risk opioid users in Europe. We have rising cocaine use. The government itself knows, and it admits in its own reviews, that by trying to crack down on drugs, you don't stop people using drugs. And yet the government continues to try and look strong with this, continuing to wage war supposedly on middle-class users and things like that. But it's tragic, really. It's pathetic. We talked earlier about Portugal. It is worth reminding ourselves, why did Portugal act? They acted out of desperation. They had a rising death toll. They had some of the highest levels of heroin use in Europe. And so they very bravely decided to do something different and to decriminalise drug possession, to focus on health, to shift away from the jaded old drug war rhetoric from abstinence-based campaign, and to flip funds into treatment. And now look, the latest data for there showed, I think, that they had 62 fatalities in a population twice the size of Scotland. Scotland, by contrast, like the rest of the UK, has the highest rate of drug-related fatalities in Europe. The drug war is proving so catastrophic, and it's felt by some of the most vulnerable communities in the country. Those people with mental health problems, with addiction problems, and those communities, the poorer communities, who are suffering from the violence of gangsters who are controlling the drug market, which has been outsourced by the government into the hands of some of the worst people in the country.
So Alex, from your point of view, in this white paper there are proposals to take away people's passports, to ban them from driving if they're found with recreational drugs on them more than once or twice. Do you think this will have any kind of deterrent effect on people? Will they stop taking party drugs or smoking a bit of weed?
To be honest, no, I don't think it will have an effect. It's interesting that the title of the white paper promises a response that is swift, certain, and tough. There's an echo there of what we criminologists have known for centuries, which is that punishment, in order to be effective in deterring offending, needs to be swift and certain, but not necessarily tough. So we're good at being tough, but we're not very good at being swift and certain, which is the opposite of what the criminological evidence would tell us is the way to go in deterring any offending, and one could apply that also to drug possession.
I also question this language of the word tough, because is it really tough just to lock up vulnerable people? Is it tough to lock up people with mental health problems, with addiction problems? It's far tougher to make people confront the demons which drive them into the arms of addiction. It's far tougher to actually stop the gangsters who are profiteering out of these policies. I think the language being used is so wrong, because actually it's a sign of incredible weakness by the government, incredible weakness by politicians who are scared to take on the tired old narrative of the war on drugs and scared to show leadership. They're being weak and their policies are weak.
Ian, if I was kind of playing devil's advocate, I think they would say about this paper, it's not about the people who are deeply addicted to drugs. It is literally about middle-class people who have plenty of money to buy from dealers, go to Ibiza, go to parties, etc., etc. So that's, I think they would say, is the target of this white paper and the tough approach.
But 1 in 10 of British adults have tried, say, cocaine in their lives. Many more people have tried other drugs. And the studies show that actually it's an anomaly to pretend that it's a middle-class problem. We've got to be careful in how we operate. It's all very well trying to target and trying to present this cliche that drugs and cocaine or cannabis is being used by a few middle-class people, supposedly in Islington. The reality is drugs are prevalent across society, just like drink is used across society. And let's not forget, of course, that alcohol is more dangerous than some of the drugs which are actually illegal, which is what got the former drug czar David Nutt sacked when he pointed this out to a new Labour government.
There's no measures being put in place by which the police will actually target middle-class drug users. So what it'll end up being applied to is the usual suspects. And we know who those people are. They're young people. They're primarily black people. We know, for example, that black people are 8 times more likely to be stopped and searched than white people are. And the majority of those stop and searches are for drugs. mostly for cannabis. At the moment, many cannabis offences are dealt with through out-of-court disposals that don't lead to a sanction. What this new white paper proposes is that even at the first offence, you would have to go to a drug awareness course. By the way, you have to pay for it. So if you don't go to it, or if you can't pay for it, then you get escalated into a new regime of punishment. The actuality, if this new white paper is implemented, would be to ratchet up the punishment of young black men.
If, as you both seem to be saying, we're not doing this very well in this country in terms of dealing with drugs, are there examples of countries that are doing things better, who are getting it right with these sort of problems?
Well, there's more than 25 countries which are changing their policies. There's just been a meeting this week, I think, between 4 European countries, including Germany, to look at how to approach marijuana in a different way. We're seeing in America where there's cross-party unity in trying out new ways of approaching drugs, not just with legalizing cannabis use, but also with some drugs that were seen as harder drugs. We're seeing it in Latin America. We're seeing it in Asia now. We're beginning to see new approaches being taken. The reality is the world is changing, and Britain is looking very out of step on this. Police have become fed up with it, as well as a lot of politicians. You have police forces across the country who have just decided to press ahead with diversion schemes. This began in Durham. The guy in charge was a no-nonsense cop. He ran the best-performing police force, so was impervious to any political backlash. And they began pressing ahead with diversion schemes, even for people who were dealing small sums of heroin to feed their own problems. This was then picked up by other police forces, including, intriguingly, Thames Valley, which was done in consultation with the local MP, who happens to be the pretty hardline former Home Secretary and Prime Minister Theresa May. The tragedy of what we're seeing is that everyone knows, basically, that the policies we're pursuing are wrong, but no one is brave enough to publicly come out and show the leadership to start reforming and start changing and start the national debate that we need. To me, it's an absolute symbol of what's gone wrong with British politics, that we're stuck in this old-fashioned, this time-warped debate where we have a leadership which is pretending it's about a few middle-class weed smokers, when actually the issues are so much more fundamental, and Britain is getting left behind.
Alex, there are some countries that have taken a braver stance, as has been mentioned. Is there much evidence yet about positive impacts about a different approach, about decriminalising possession of cannabis and maybe harder drugs? Has it started to reduce the amount of harm, crime, mental health problems, and so on?
Before we get into the details of the research, I'd like to let us consider the fact that drug policy itself is not very influential on the level of drug-related harms. So if you ask me about who has the best drug policy, well, I'd start by saying, well, who's got the best social policy? And so it's not just about whether a country has decriminalised or legalised a certain substance. It's about what support does it offer to people who have traumatic childhoods, who have mental health problems, who become disconnected from society. And so I would ask people to look at examples like Switzerland and the Netherlands, where that has been done. And what the evidence shows us is that the levels of drug use in the country seem to be entirely independent of the levels of punishment that people are being threatened with. And in evaluations of decriminalisation, so for example, myself and my colleague Dr. Caitlin Hughes published the first peer-reviewed study of the Portuguese decriminalisation in 2010. And what we found in that study was that there wasn't a particular effect of decriminalisation on levels of use. We also insisted that people should think about what else Portugal did was, as Ian suggested, implement a wide range of harm reduction and treatment services. But not only that, they also changed their social policy. An incoming socialist government introduced a guaranteed minimum income and dramatic improvements to social housing. So we need to think much more broadly than just drug policy about how we reduce the problems that are associated with problematic drug use, because they are not just drug problems.
By tying it in with a lot of harm reduction policies. And bear in mind, it's still illegal to deal drugs, for instance, in Portugal, and people found with small quantities for personal use are sent before a sort of local commission with maybe a doctor or a social worker to get any issues dealt with. By having this sort of approach, Portugal not only has among the lowest levels of drug-related deaths in Europe, but it also has some of the lowest levels of use in Europe among younger generations. So clearly there are examples to show that these policies do work. It doesn't solve the problem. There's still a bedrock there of high-risk opioid users, although their numbers have fallen significantly. But places like Portugal, the Czech Republic, in a way much more than the States where it's all been so haphazard and ad hoc, do show that there are alternative approaches. And if you combine a change in legality with a change in the sort of societal approach, that you can have lower and less problematical use of drugs, which surely should be what every society is really seeking.
But then can we come back to the UK and the lack of any political kind of consensus about decriminalisation? Why are the main political parties so far from these other countries' policies?
It's funny, I was just looking at Twitter today and I noticed Michael Fabricant, who is obviously on the more conservative wing of the party, is saying that the drug war doesn't work. I remember speaking to another very prominent figure on the right, and I went to him to get a quote, just looking for that sort of quote from someone to say, lock them all up. And he said, I know what you want. He said, but I'm not going to give it to you because I think, although I believe in that everything should be illegal, and I don't like, I like the way it's been done, I can see that it's not working, it's failing, and maybe we should try something else. I think there is an acceptance in politics that goes wider than you might expect at Westminster that we do need to change. But unfortunately, those in charge, both Labour and the Conservative Party, are terrified of the media backlash, painting them as being soft on drugs, and terrified of the impact this would have on some of the key battlegrounds where there is a strain of social conservatism deemed to exist within societies. There is this view that people are just scared to take the leap, to challenge some parts of the media, to challenge the narrative, and to stand up for a slightly more sensible approach to it. But I think if they did, I think they would find that the public and a lot of their own backbenchers are actually in a place they might be surprised to find, and that they could tackle some of the prejudice that exists on these issues, because the electorate is much wiser, I think, than it's often given credit for, and people live in the real world, and people know people who have problems, and therefore people are looking for solutions. And although there is fear of drugs, there is fear of the idea of a free-for-all, of legalizing everything is challenging and slightly terrifying to a lot of people. But there is room for a grown-up debate on how can we reduce harm, and with a sensible approach, and you can take your community, you can take society along with you.
But Alex, the evidence I've seen on public opinion about drug decriminalisation isn't that encouraging. On the face of it, quite a lot of people seem to favour a fairly harsh stance. Is that your reading of it?
Not really, no. In recent years, there's been quite a lot of polling showing that there is a majority who prefers either legalisation or decriminalisation to criminalisation of the possession of at least cannabis. That support's a lot softer for other drugs. But I think we need to recognise that it's not true that everyone thinks that punishment has failed. There are still true believers in traditionalist moral values, that it is wrong to be intoxicated by these substances, that it is almost sinful to use them, that by using drugs you're being irresponsible, that you're causing harm to yourself and often to other people. That is not an opinion that has gone away. Indeed, it is the opinion that's held by the people who currently are in charge of drug policy. It's a lot more convenient for politicians who've been in charge for a long time to blame drugs than their own policies for the social problems that persist. So this strain of traditionalism in British society and British politics combines with a strain of paternalism and the idea that public health professionals and the government knows best. And so the most dominant actors who have power over what the policies will be and how they'll be implemented basically agree among themselves that it's best that they're in charge and that they want to use the traditional measures to cut supply, threaten punishment for use. Now, we know that's not the evidence, but we should be very wary of thinking that policy is based on evidence. Policy is not based on evidence. Evidence is useful. It might help people learn how to achieve the aims they choose for themselves, but the aims they choose for themselves are much more frequently based on their moral positions rather than the evidence of what would be effective.
But also, of course, drugs can be harmful, although millions of people use them every week without it doing themselves any harm whatsoever. There are some people who can harm themselves with drugs. It's like butter, it's like booze. The role of government is to work out the best way to ensure that there's the least possible harm while ensuring that they are offering as much freedom as possible. And that's where they're failing so grievously on this particular issue, because they're actually not only acting in a very liberal manner, but they're also making the harm so much times worse in so many different areas.
Well, if I may say so, that's quite a utilitarian vision of what government is supposed to do. And we've seen several examples where government is quite willing to take decisions that are actively harmful to the British interest, to the public good, because it suits their moral purposes. And drug policy is another area where utilitarian arguments don't really fly in the face of these moral preferences that are strongly held by the people who have the most power to implement them.
Ian, one person who's maybe bucked the trend is Sadiq Khan, who says he's more supportive of a more nuanced approach, will never simply be able to wrest our way out of the problem. What do you see happening over the next few months? Because we've got actually a harder line policy than ever if this white paper is turned into legislation. And then we've got police forces who are doing something completely different. Do you think they're going to be clamped down on?
No, I think the police forces will carry on because no one's really done anything to them so far. And when it's led by someone like Durham, who have such a good record, then it's very hard to do anything about it. I don't have much faith in seeing any leadership coming from Westminster, although there are more and more MPs who are coming out and challenging the consensus on both sides. My hope is that we see more of them coming out and speaking out and calling for a change in policy. But I'm not optimistic, certainly not before the next election, that we're going to see anything dramatically different. I guess the best we can hope is that, to see a little bit more money put into mental health services. I think, as Alex says, there is a majority now for legalization or reform, at least, of the cannabis laws. Ultimately, I suspect Britain will fall into line with other wealthy countries and in some form adopt a decriminalised, legalised model, although it may take 5, 10, 15 years to get there. The far harder battle, and I think the more interesting battle, is to try and introduce a harm reduction policy for what are called hard drugs, such as heroin, cocaine, fentanyl, things like that, where this is much more challenging to members of the public, but equally the damage is much more severe, both in terms of what it does to criminality on the streets and in what it does to killing people and wrecking families. The one interesting group I think is really helping to change the narrative on this is a group called Anybody's Child, which is set up by parents of kids basically who have died from drugs. And they're incredibly moving stories. And a lot of these people had the same views that drugs were all bad and should all be illegal. And they changed their mind only after the most appalling tragedy of losing one of their children. And these parents arguing through their perspective is, I think, a really powerful way of trying to change the narrative on this.
I think over the next 2 to 3 years, until the next general election at least, all the interesting action in British drug policy will happen at levels below Westminster. Most of the action is coming from the devolved nations, Scotland and Wales, and, as Ian has said, local police forces and their partners. At national level, I think it's easy to get distracted by all the rhetoric around getting tough on drugs and forget what's actually going on in terms of where the money's going. So in the 2021 drug strategy that was announced in December, there was a lot of talk in the press release about getting tough on drugs, but where the money was £533 million to spend in England over the next 3 years on reversing the cuts that had happened to the drug treatment system over the previous 10 years. So I hope that local agencies will be able to use that funding to do a lot of good in their local communities.
One area where the government have said they're going to try something again is with these problem-solving courts. which, at least in part, are similar to the kind of drug courts that they have used, which can deal, I think, with people who have addictions to harder drugs than just cannabis. What do you think about that? Do you think there is any merit in these kind of courts where a judge perhaps checks on the progress that somebody is making every month or so to see whether they're staying with the program and trying to help themselves get off drugs?
The idea of problem-solving courts has been revolving through the policy system since at least 1995, when a guy called Justin Russell went to America and wrote a report about drug courts. So the Labour government then adapted Justin Russell's proposal to have drug courts in Britain. And there were also drug courts piloted in places like West London. They were evaluated and shown not to be as effective as people had hoped. And so we still don't really know if these problem-solving courts do actually reduce offending or solve the problems they're supposed to solve. We know they're quite expensive compared to some other forms of community sentence, which might be more effective than they are. So if we are to see a new rollout of problem-solving courts, I hope they're evaluated more thoroughly, and we think about the cost-effectiveness and the opportunity costs of investing this money in problem-solving courts compared to things that we do know work.
Ian, you're quite a fan of problem-solving courts, drug courts, because you've seen them in the States where they appear to work, certainly in some places.
Yeah, I think they're, when done right, they're incredible. I went over to see them operate in Texas, and then I took Michael Gove over for a BBC panorama that I made, and Gove, in his brief time as Justice Secretary, became completely sold on them. But he also saw that the only way you make them work is with proper funding. I mean, the one I saw, there was a fantastic judge, and I think he had 21 staff, and people had to come in repeatedly. Basically, these guys came in and they said that the judge became like a father figure to them, and he helped them with their housing, he helped them with jobs, helped them with any family issues. And it's an incredible holistic approach. It is expensive. It's really expensive. But it's also, when it's done properly, fantastically effective, because it sees that the problems are not just about the use of, say, heroin or crystal meth or whatever. It's very moving when you hear these guys who perhaps have grown up in a broken home, who can't read and write, have been in and out of jail all their lives, been involved in perhaps petty crime suddenly say that this Republican judge who liked going off shooting animals and had lots of them stuffed around in his room, in his office in the court, that this guy was like a father figure to them, because he was for the first time trying to sort out a lot of the problems which are stopping them being really fully functioning and productive members of society. So I do think drug courts can, and problem-solving courts can, have a really good role to play with some of the most intractable issues, but only if they're done properly and with the sort of funding and persistence which we've never seen them given in this country.
Yeah, I mean, I've seen them in the States as well, and I have to say I've been incredibly impressed by some of the dedication of the judges. And where it works well, that judge knows all the agencies who deal with drugs, the sort of programs that can be done and so on. He or she gets to know the people who have been convicted of this drugs offence or are on the program. So I've never seen anything very similar in this country. It's a kind of drugs court light that we've done in the past. And so it'll be really interesting to see with this new iteration where they're starting again, whether they can really get to the spirit of the US program. But I have to say we need to try and move to an end. So, Alex, if you had the power to make just one change to the UK's current approach to illegal drugs, what would it be?
I would repeal the subsections of the law that make it a criminal offence to be in possession of these substances. This approach to dealing with drug possession has not reduced drug use. It hasn't reduced drug-related harms. It has imposed huge costs on the people who are criminalised for those offences, on the people who are stopped and searched on suspicion of those offences, and it's also wasted huge amounts of resources in terms of police time and the time of prosecutors and the courts of dealing with these offences. We have not seen good evidence that the threat of punishment for possessing small amounts of drugs does any good.
Ian, what one change might you make?
I'd just like to see a leader come out and say, hey, you know what? I recognise lots of people use drugs and we've got to move towards harm reduction. So let's work out the best way to do that. And we'll look at anything we can do which allows people, because some people are going to use drugs, to do it in the most safe way, both for themselves, for their families and for the rest of society.
Thanks, Ian, Alex and Rob. If you'd like to know more about drug decriminalisation, check the programme notes for links to Alex and Ian's work, or join the conversation by tweeting us at @TransformJust1. And if you've an idea for an issue you want to discuss with us, do get in touch. Thanks, and goodbye.
Goodbye.
Goodbye. Thank you.